This is UNAIDS.
It's important to highlight that we have around 2 million adolescents living with HIV right now. And this report that's been launched now has shown that HIV is the second leading cause of death among this age group. And this is really a wake-up call for health workers and authorities throughout the world. One of the reasons is that if a child is born with HIV or acquired to breastfeeding, for example, and they grow up and they are not diagnosed, and the virus is multiplying in their body. And when they are diagnosed at a late stage of the disease. So sometimes it's too late for treatment. Another important reason is the type of medicines that are available for children and adolescents. Because the clinical trials, when you're developing a new medicine and you're trying that out, it's usually the clinical trials are done in adults. So the availability for children and for adolescents of the newer type of drugs comes very late, and so there are fewer options. This is a complex age group to monitor, and most of the data that's available right now comes from modeling. I think this report shows us once more the need for us to have a strengthened health information system that gathers information, collects information, data around adolescents that could give us a more accurate snapshot of the reality of the health of adolescents throughout the world. One of the issues that have to be addressed is the testing, access to testing for adolescents. And in many countries, for example, an age of consent is required, and then you have policies in place where the adolescent, if he wants to get tested or she wants to get tested for HIV, they have to bring some relative or mother or father, and that doesn't usually happen. So we need to make these places friendly, the policies friendly, so that adolescents who want to protect their own health, they should know their status. Another issue that's very important is related to support for adolescents to keep on treatment, because being on treatment for HIV is not easy. The drugs, you have to take them every day, you develop the resistance and so on. So the health system has to adjust